All right, so back up for a second. So, welcome everybody. This is our long COVID group. We're only recording a portion of it today, specifically as it will relate to questions and answer on some of the cannabinoids and also some of the supplements for long COVID related symptoms. So, we just started. I started talking about use of cannabinoids for sleep. We have about half of the group at least has problems with sleep, which is one of the most common symptoms of long COVID. And frankly, that's also the one symptom that if it improves, you're probably going to improve pretty much all the symptoms that you have. So that's why I think it's a highly, highly important topic. So I typically start nowadays with pure CBD. And then what I do, so the process goes like this: start at around 25 to 50 milligrams of CBD, somewhere between 30 to 60 minutes before you go to bed, and then titrate it up to 100 milligrams. At 100 milligrams, if you're not seeing any significant improvement, that's you start adding other things. The first thing that I add to the 100 milligrams of CBD would be the CBN. CBN. Um, Both are available without needing to get a medical cannabis card in any state. All of you here today, regardless whether you're in DC, Virginia, or Maryland, you can simply have this shipped to your house. If you need particular link with the brands that I like, just shoot me an email. I will set you up. It'll basically be the email with the discounted code and particular link to the product that I use. Now, so after you added CBN to CBD, if you're still not sleeping, then you got to move on to THC. Why this is the order? Well, because THC requires a card, right? So that's as simple as that. Everybody familiar with the terms I'm saying? CBD, THC. Do I need to explain? No, right? All good? Okay. The amount of THC needed for sleep can be quite little, but the problem with having THC in a higher dose for sleep, yes, it can work beautifully. The problem is not only the card, but the fact that there could be some side effects. And the THC, in contrast to CBD and CBN, can disrupt sleep architecture at the higher dose. So if you're lucky and you only need 2, 3, 5 milligrams, you're fine. But if you need 10 to 20, you may actually, in the long run, it's like it's just not as ideal. That's why this is the sequence. But I will tell you, at least 70% of people will have to have some THC. No matter how much CBD and CBN they try, it doesn't work. Why? I listen to some lectures where there's a couple of speakers keep pushing CBD upwards of 2, 3, 400 milligrams. I never do that. That's when you start having interactions with medications. So you got to be careful with how much CBD you take. And also, if you take 400 milligrams of CBD, you're going to be footing a bill of $300-$400 a month, because CBD is somewhere around $150. So 50 milligrams, 40 to $50 a gram. So if you're taking 400 milligrams a day, then that gram lasts you for 3 days. You have to do the math. So that's for that. Um, Now, interestingly enough, I have not seen cannabinoids being dramatically effective for POTS. In fact, there is a fear that especially THC containing products can sort of destabilize the POTS, can make it worse. I think it's a theoretical fear. I actually feel that at the microdosing, some people with orthostasis can actually get some benefit. But the J curve, so meaning when you start at the tiny dose and then you titrate up, you're going to hit the sweet spot. I think the problem is that the sweet spot for the POTS with THC is very, very little. And a lot of people miss it, and so they pass through it on the other end, where you start having the upstream of the J curve, where you actually end up with more side effects than benefits. So if you're going to try it, you have to be very, very careful. I would suggest starting with 1 milligram. 1 milligram of THC equivalent. Now, I know some of you, without saying name, already been taking THC for pain. Now, that's a separate next conversation. So you may be very tolerant already, and then this doesn't apply to you. But if it does, start with as little as you can and then titrate it up. So correct. Higher doses of THC in some patients can disrupt the sleep. There is this whole principle of outdated idea of indica and sativa, right? So you guys may have heard this. So indica is supposed to be calming, sativa activating. We don't like to use those terms because they're relative and highly inaccurate, meaning same brand for one person can be indica-like calming and for another person activating. So that it's better to use specific terpenes. Terpenes are the smell molecules. If you guys want, I can put slide on that so you can see that if you're interested. But the terpenes are basically the smell molecules. So something like pinene from pine would be very activating. Something like myrcene, which is the hops-like smell, so beer also would be quite sedating. And a linalool from lavender would be also quite sedating and calming. So, all right, somebody does want to see that slide. Just give me 1 second. I will put that up at some point. So that's correct. So if you take even a lower dose of THC, but with a stimulating terpenes, you're actually going to end up, unfortunately, with potentially not sleeping. And then that obviously would be a big problem. So I'm going to put this slide on real quick, just so you have some. Terpenes are actually very valuable in understanding because they're present not just in cannabis, they're present in all kinds of molecules and all kinds of plants. So the myrcene, which is, by the way, they're typically in a particular oil. If it's a full extract, you're going to have all of them. The question is which one's going to be predominant, or 2 or 3. So the hops, I mentioned myrcene calming. You see how it's separated, left calming, right energizing. So the limonene, pinene, and terpenolone, this kind of a fruity nutmeg and tea and cumin smell, those would be the most activating. And usually recreationally, most products are in this area, simply because that's what people want to use, right? You don't want to smoke and then go to sleep to get high. It's exactly the opposite. So historically, when you're going to a regular dispensary, if they're not highly medicalized, you may end up, chances are, buying something here, even if it's a sublingual oil or the vape. And so you have to kind of know this, otherwise your sleep will actually get disrupted and could be horribly disrupted. I've heard stories, patient of mine walking in, getting completely inappropriate rec, getting something like 10 milligrams when they're completely naive of the sativa and then staying up all night and the next night. So I've seen that. So you do have to be careful. That's why the THC that's why I don't start with THC anymore.
Dr. Kogan, can I interrupt you for a minute? Just
Sure.
Because somebody has to leave and just wants to know, that has one question about CBDA.
Yeah.
How long you need to be taking it before it helps with chronic inflammation?
It takes quite a long time, probably at least 4 weeks, maybe more like 6 to 8. And the problem also, I guess Janine is asking. Who's asking? Janine? No? And the other issue with CBDA, you have to titrate it also. So I usually start with 10 to 20 milligram twice a day, and then I titrate it up. At about 100 milligrams a day of CBDA, you could get extremely potent impact. So like anybody who have arthritis, like say osteoarthritis of any kind, or even rheumatoid arthritis, like basically a bad joint, for example. And at the same time, you have this post-COVID inflammation in different parts of the body. That's the perfect person to take the CBDA trial. Again, I could send you also the brand that I like. The problem with CBDA, don't buy it in the random places. A lot of the CBDA is not extracted correctly. It has to be a water extraction. CBDA and all acidic forms are highly water soluble. They're the only forms of cannabinoids you can actually take in a liquid form, not in an oil form, in a water, alcohol, or in capsules. Don't take CBD in capsules. You're just wasting a lot of money. But the CBDA, because absorption is like less than 10%. But CBDA absorbed way better, at least double the percent absorption, and it doesn't seem to be a big difference sublingual versus capsule. So that's one important point. Okay. And at 100 milligrams, I've actually seen rheumatoid arthritis being controlled just with CBDA. I mean, it could be that potent for some people. Pain, I guess, next, right? So pain is, if the CBD is first line for sleep, pain is the THC first line. Because no matter what you hear that some people respond to CBD, that response rate is probably less than 10%. Now, you may have some CBD in the mix because sometimes CBD will potentiate pain effects of THC, but do not have pure THC, pure CBD for pain. Don't expect much. Titration and the frequency is 2 to 3 times a day. How to apply and what particular route depends on the pain. So if your pain is localized, I would try to deliver THC right there. So, for example, if you have a pelvic pain of any kind, suppositories would be my first choice, for sure. Just because of the proximity of where the pain is located. If you have a general pain like fibromyalgia, or let's say that COVID caused diffuse joint pain, or you had pre-existing pain from other condition like, let's say, Lyme, and then you need to have more than one area controlled, you'll have to take it systemically, probably swallowing it, or drops under the tongue. Drops under the tongue is usually first line. I'm not against smoking, but I'm against smoking large amounts, and if you do need to inhale, you have to use the vape. That's my suggestion, because smoking is much higher temperature, much more destructive for the lungs. Doses titration. Start low, go slow. It's always the mantra. Okay, I'm gonna stop here and ask where you guys want to go with this. Don't be shy. Because you know me. I can talk. I can talk about pretty much anything.
Another question we got was, what are the symptoms to watch out for in terms of THC affecting pot symptoms?
So, well, you basically potentially could get a lot more dizzy. Blood pressure can drop. Unfortunately, THC has a universal antihypertensive effect. The drop is somewhere between 5 to 10 milligrams, depending on 5 to 10 millimeters of mercury, depending on the dose you're taking. So if you're already running low blood pressure, and every time you get up the blood pressure crashes, you may have way lower drop, more significant drop. So you have to be careful. Usually it's an adjustable variable, meaning eventually there's dependence that forms, so that the symptom goes away, but it may take months before you're going to feel the stability. And so a lot of people, especially, I would say it's easier to not have this problem when you're doing low dose sublingual. When you're taking inhaled route, the problem with inhaled route, you take a lot more in, just by the mechanism of intake, by the route. Your route of administration, inhalation, will always give you magnitude higher dose, regardless of how you try. Lung absorption is decent, and just the way that all of the inhaled products designed, you can easily get 20, 30, 40, 50 milligrams of THC right off the bat, and that could be, that could throw you off. I see muscle spasm. So muscle spasm THC is really, really good for. In fact, if you kind of look at the level of quality of evidence, let me share something again, because I think that's important. I like to actually stick to the data, because otherwise this whole topic can be so amorphous and so like, oh, the expert said this, the expert could say whatever. So this is probably the largest data, the most significant report we have. This is a 2017 National Academies of Sciences. They had a good team. Donald Abrams was one of my main mentors in the field, has been one of the major voices in this. And so they did this whole, basically, very careful assessment. This is what they concluded. You have a conclusive or substantial evidence. If this would be a drug, this would be first-line treatment instantly, because NAS does this for all the fields, not just for cannabis. So for the treatment of chronic pain, antiemetic, and the spasticity, okay? So the spasticity is where cannabis shines, just like for chronic pain, but you have to use mostly THC. Similar to chronic pain, the THC seems to be the key here. It could be oral. So in studies, actually oral cannabinoid was found more beneficial than inhaled products. And they used here synthetics. So this is even dronabinol, which is pure THC. I don't recommend pure THC because it's devoid of everything. It devoids of flavonoids, it's devoid of terpenes, it's devoid of minor cannabinoids. You know, most of the, when you look at the actual typical product, typical label, you know, you're gonna have mostly THC, but then you can have CBD, well, very little here, but some CBG, and then you can have some acidic forms. Like in this actually, this is a quite high in acidic form. So yeah, so depending on how this was prepared, you're going to have other things in there, and that's quite important to make sure that you don't miss. So even you take pure THC. So the definitely spasticity, and then you know, there's a whole bunch of other things here which I'm not going to cover. But for spasticity, whoever asked, totally worth a try. CBD is not going to work, so you'll have to go straight to THC if that's a part of the problem. Okay, Emma's asking if someone is trying THC hybrid for the first time, do you have a recommendation for the best way to ingest it? Okay. I don't recommend to start with edibles. I think that's what you're trying to ask. I recommend starting with drops under the tongue. There's two reasons for that. A, it's a lot easier to titrate. So you can just start with one drop, right? And even if the product is very concentrated, let's say 600 milligrams in an ounce, which is very concentrated, that means that in 1 milliliter, you have 1/30th or 20 milligrams. If you take the 20 milligrams straight up, you know, you'll be tripping the whole night and probably the whole half of the day after if you're naive. But if you take one drop, that's 1/20th, that's 1 milligram, right? So you're probably not even going to feel anything. So that's the point. But then you titrate it up. Once you know your dose, let's say you figured out, okay, at 10 milligrams, it's a perfect dose sublingually. Then it's the good time to transition to the ingestibles, to the oral. Why the oral could be preferential? If you're doing it for sleep, your under the tongue drops will work for 2 to 4 hours, and then what? And then you wake up, and now you have problems, because if you try to take a second dose in the middle of the night, it'll take another 20-60 minutes before it kicks in, and it may not work, because you kind of, the body already kind of processed the first dose, the second dose may not work well. So you're way better off than take edible, which could last for up to 8 hours. But you don't start with edible. A lot of people do. Dispensers often push people, but remember, dispensers going to try to sell you stuff. They're in the business of trying to make sure you come back, and for them, usually it means you're going to get high, because that's what brings the young people back. And unfortunately, that's what the business set up to do. Now, the better business is the older ones, Tacoma Wellness particularly, but also Holistic Healing in DC. Those tend to do a better job. They kind of understand the lay of the land, and they've been around for a long time. They know how to sort of cater to the medical patients, not just to the general crowd. Yeah, so the vaping and smoking for sleep could actually be better for a very strange reason, because typically we want to take a pill and go to bed, right? It's not like, okay, I'm going to sit there and calculate that I need to take my CBD or my THC 60 minutes before I go to bed, because that's when it peaks, right? And it's a kind of, it's not that easy to do. We want something to be 5-10 minutes and then it works. Smoking is the only route that does that. Vaping too, vaping and smoking. Smoking will hit in within 30 to 60 seconds. Vaping can take up to 10 to 20 minutes. It's much longer, but it's way faster than putting it under the tongue or swallowing it. So that's that. But again, I generally don't recommend starting with inhaled, just for the reason why. If you can find a dose of sublingual or orally, it's way safer. Anything smokable is a problem, because you're just going to inhale something at the hot temperature. You're going to have some temporary negative impact on your upper airways. You may cough. The cough may actually become chronic if you do it every night. So you do have to think of all those things. That's why I never personally recommend starting for anybody with inhaled route, understanding that some people will prefer it, especially if you have some experience. So if you have experience and if the inhaled route works great for you, perfectly fine. Just be cognizant of on amount you're using, and maybe try to get higher grade inhalers. The higher the grade is, the more control of the temperature you can get. So you can get pretty low temperature inhaler like Pax or Volcano, and then actually you can have almost no harm at all, because the temperature is cooler, there's no burning, there's no coughing, way better tolerated. But the cheaper products, especially, or if you're burning, if you're like doing a joint, for example, I mean, you're gonna cough and you're gonna have accumulation of long-term possible negative impact to the lungs. Okay, which topicals for the great question. Okay, so definitely I would probably start out with one-to-one THC to CBD for spasms. Why? Well, because chances are that your spasms have something else undergoing there, so there could be some local inflammatory response. That's why I like to mix things with one-to-one. It's also a principle of CBD tend to potentiate certain effects of THC. The only exception here is the pain. THC does not CBD does not potentiate analgesic effect of THC. It may in certain inflammatory states, but not directly. And so if you have kind of a burning neuropathic pain, if it's not an inflammatory in nature, if it's not associated with diabetes, if it's not associated with some toxin, um, I probably would, let's say, just B12 deficiency or some other idiopathic neuropathy. I may just say, just try pure THC cream. But for a lot of the other conditions that have some kind of inflammatory component underneath, definitely throw in CBD would be good. So I think that plan is very good. CBG can be very, very good for spasms and for chronic pain. I have not seen CBG topical yet. I have not seen this on the market, but you can make your own. I think, Anna, I think that's what you're implying, right? So you're putting the CBG drops straight on the skin, or you're taking them in, or you're swallowing them. We can't hear you. You have to unmute yourself. We still can't hear you. Huh? Is it just me, or everybody cannot hear her?
We can't hear her now.
No, you sound too, I think you're too
We
loud.
can't hear you. You may want to type stuff up then. Yeah. Okay. All right. So I don't have a pain but sleep problem. It sounds like yeah. So Alfred, shoot me a message if I forget, because I probably will. I will send you a link with CBD for sleep to go ahead and try. The other thing, remember, anybody who have any kind of chronic inflammatory response, it's worth trying CBD for that.
Okay.
So, but CBD thought to be calming. You of course all hear that FDA approved CBD for certain types of seizures in 2019. That's part of it, right? So anything that's used as a seizure medication is going to probably have neurocalming or anti-neuroexcitatory effect. So that's one of the reasons why CBD has been kind of used that way. So good question. So Anna, it really depends what your spasms are. If the spasms are deep, topical will do zip. You're gonna have to take things systemically, inhaled or oral or sublingual. But if it's more of a topical twitches, like especially if you have something like a restless leg syndrome, which sometimes is really more kind of, you can actually get a good response to the THC one-to-one THC to CBD cream. I would add some what's called hot and cold to it, so cayenne and menthol. That sometimes potentiate impact. So you can go and there's a products, they just call them hot and ice, and I think hot and ice or hot and cold, and it's 200 milligrams of THC and CBD. The only problem, those products can be pricey. Like I think that 2 ounces jar they charge $90 for, which is kind of crazy. You can probably make 5 times more cream yourself. Now you could be, if you like cooking things, pun intended here, you can literally cook stuff up that you're going to save tremendous amount of money if you start with a whole extract, because it's just, that's what they have to upcharge a lot for this products, because the market is small. So they charge, like for suppositories, the prices are insane. They're like almost $8 to $10 a piece, and they should be $1 a piece or like $2 a piece. So that's very, in my opinion, but that's because there's such a little market for them. Nobody gonna smoke the suppository, right? Yeah, can of butter is perfect. Yeah, icy hot. I think that's something like that. Yeah, I think it's a District Cannabis brand that makes that product, or maybe Dr. Solomon's brand. I can't quite remember. But they're in all local dispensaries, not just in DC, but in Maryland too.
Did you see the question about if CBD helps for COVID headaches as part of
Yes,
pain?
yes, great question. So CBD, for the headaches are a little different, especially if they're migraines. First thing to try is CBD, not THC. Why? I don't fully understand, but there's been some decent reports on CBD for migraines. So I definitely would, and I would titrate up to upwards of something like 50 to 75 milligrams twice a day to get there, just to see how you feel. And that would need to be sublingual. You could get actually CBD vapes. They are available. In fact, they're sometimes even available directly from the, I think even, let me just check. I think Lily Hill makes them. You guys keep putting questions in. I'll check to see if that's one of the brands I like. Let me see if they. This brand is relatively inexpensive. It's probably the cheapest high quality artisan brand that I know. They only make CBD though. They make some CBG 1-to-1, and they make really good topicals that are very good.
Full spectrum.
Oh yeah, well it
Full
has
spectrum.
full spectrum.
It's a company.
I think, guys, I think everybody stopped making inhaled products because of what happened a couple of years ago. There was this called EVALI, EVALI. So there was a whole bunch of bootlegged cartridges that contained some toxins, and then like over 1,000 young people died. They were smoking products, and then of course everybody started blaming pot for this. Turned out it has nothing to do with that. But because of that, the market, all these brands that were selling direct to consumers CBD products, they stopped making it because they're really afraid of any kind of fallout from this. But it was a bummer because actually they were really good products. So you can inhale CBD cartridge, the vape, and actually feel better. The headaches. I had several patients report great results with the inhaled CBD. You can get inhaled CBD from dispensary too. No, from like with the medical card. They're all gonna have high CBD grade, like 10-to-1 or even pure CBD vapes. Capsules are not okay choice for CBD, or if you're trying to, because you're gonna waste a lot of money. So let me show you why. I have to show you pricing so you understand. So let's say I pick their capsules. So here you have, let's just pick something like this. So you have $100 for 90 capsules of 25 milligrams each. Remember that number. Now you go and you get a tincture, the oil, and let's pick something that's about the same price. Now here it's looks like it's less, right? Because it's only 1,800 milligrams, but the absorption here is at least 2 times better. So your capsules, when you take, you're getting half of those 25 milligrams. So instead of 2,200 something, you're only getting something like 1,100. And frankly, even this is only absorbed at about 70 to 80%. But the capsule's absorbed at only 10%. So when you swallow the 25 milligrams capsule, you're only getting 2.5 milligrams. So that's the problem systemically. So you have to take a lot more. That's basically what all this means. Now, it's not a problem if you don't care about the money. Take more capsules, right? But most people do. All right. For the headaches, you're probably going to need to take CBD at least for a week before you're going to feel some impact, and you will have to titrate it gradually. It's different with THC. THC takes impact almost instantly, like from the first dose. Of course, you're going to titrate, right? Because you don't want to, because you don't know what your dose. If you've never taken it, you don't know where your ideal dose is. That's why you have to start and gradually titrate. CBD is less so. You could start a lot higher because it's very unlikely you're going to have problems. But you still want to do titration. CBD takes longer to titrate. THC can probably up titrate if you have a lot of pain in a week. with CBD, you may need to take 2 to 3 weeks. So don't give up right off the bat. Like you took a couple of doses and nothing happening doesn't mean that nothing is happening. You may just need to wait a bit longer. So a week, I would say minimum to see some impact. It's longer with other forms. CBDA may take 2 to 3 weeks before the peak effect occurs because you need to reach a steady state, and because anti-inflammatory impact is slower generally. Should we stop here? So we have about 17 minutes, or should we get maybe 1 or 2 more questions? So anyway, just like let's do maybe 1 more question. I don't know. Did I answer everything?
I think so, other than how soon after taking the drops do they take effect? I don't know if you...
So the drops take about 20-30 minutes before you're going to start having some effect, and then they'll probably peak in about an hour, and they'll last for up to 4 hours. So you're going to have your peak effect 1 to 2 hours roughly. Some people metabolize things slower, some faster, so this is all rough estimate. Jenny is coming in. Do you see that?
Yeah, and then the other one, we can stop the recording for. It's like a question for the group.
All right. I'm gonna mute her. That was loud. Okay. I think that is all. I'm gonna stop recording and